So, Parul, that was a great point, and a lot of things that you're talking about are very important. But one of the challenges we see in India, and as well as I'm sure you will have the same challenges, how do you identify the right kind of staff for your practice?
Um, so this is, if you talk to any dentist, any orthodontist, this is the one thing that gives them heartache and ulcers and everything else in between. I think here are the things. To identify the right staff, the way we look at it, we like to hire for attitude, we like to hire for charm, and we like to hire for qualities that are currently missing in our group. If I have to hire someone else today, I'm going to look at what I need in this person, what are our lacunae.
Mhm.
So you identify those points. I mean, is your clinical team really great at clinical work, but they are weak at patient engagement? Or you have someone who is extremely talkative, always runs late. You know, patients love this person, but work is not getting done on time. Um, so then you need people who are more efficient workers. So that's the identification process. In terms of finding people, you look for them everywhere. I just said that every person you meet is a potential patient. So if you're in a restaurant or you are in, you know, you walk into a hotel, any places where you find someone who you feel you can groom, you have to be willing to invest in people. If you want like a ready-made product, you know, you have your butter chicken plate ready, it's perfect, ready to go. I don't think that's how this works. This is got to be tailor-made to your practice, to your taste, your flavors. And that's what we've essentially done in our practice. I have had people straight out of school who we have trained. We have found people who were at cafes. Um, One of the person who I love in my practice and has so much life used to work for a dry cleaner. So we are a very varied group, and you come together for common cause, common vision, and that's the way to go for it. The other way, the other identifying point that's important to me is their integrity towards work. I think that's extremely important. They have to care about what they're doing.
Excellent. I think that's a great point. I mean, I can imagine somebody working at the dry cleaners, working for a dental practice. But I hear you. So you hire for attitude, find gaps in your own practice, hire people who are good at filling those gaps, so that you're holistically you are a much efficient organization. But the other question I have for you, which is a burning question actually, is how do you retain staff? Like when I practiced for 6 years, I went through I don't know how many assistants. Uh, but how do you retain them? How do you grow with?
So here's the thing. In any organization, I believe there's always a core team. And a core team, so I look at it as three spheres. There's a core team that is there, they get what you're doing really well, and they're going to go the extra mile for you, which means that they're going to drive around for you, whether they're clocked in or not. They're going to run these errands which are important for the practice. They're going to come tell you, doc, this light doesn't make patient photos look great. Look at this light I found. So there's a core team. The second layer is, people who will last with you for a significant period of time. And then there's this bottom half, which I call the 1 to 2 year turnover people. And in terms of retention, our rules are very uniform, I would say, on the surface. You offer them, you ask yourself, why would you stay in an organization? Are you treating your staff really well? And by that, I mean, are you very respectful? Are you polite? Are you modeling a certain behavior that you want to see in them? Second thing is, if you think you are going to withhold money and keep staff, think again. They have to have skin in the game. So we have systems in place, and you can do this your way. You can have goals of patient, you can have collections, and if the practice does well, they deserve an extra. You don't have to promise a high base salary because that just doesn't work in business. It's very, if you do well, the practice does well, they do well. And they have to be very aware of this. And you have to make good on that promise. You can't just say, oh, you know what, if it does well, I'm going to throw in this and then, suddenly get amnesia. Oh, I never said that. Never going to work. We offer retirement plans. We offer healthcare benefits. Are you genuinely willing to take care of these people? And if you are going to retain staff. And you are going to do this for the whole group. And even then, you will have some people who will leave. Remember that everybody has their dreams. Their dream is not, it doesn't have to be aligned with yours.
Correct.
However, I can tell you this, that in all these years, the people who have left us have been few. Most have wanted to come back or come back within, I would say, a year. And the ones who haven't, like I had an assistant who was with us for 2 years, and she told me from the get-go that she would like to be in nursing. And I was like, that's great. And I'm happy to write you recommendation letters. To this day, she is willing to come in if she's free and we are in a bind. And she's a great ambassador for our practice. They send patients your way. Are you treating your staff so that even if they leave, should they choose to do something else, they are leaving with some level of sadness because they like you as human beings, and they are still going to promote your cause. They're still rooting for you.
Correct. So
So
those are your more valuable than any referral or marketing you're doing, because these are employees, permanent employees who continue to send patients your way.
yeah,
And that's actually a very good indicator of how loyal or how well they've been treated and how much they believe in the values that a organization or a dental practice has.
I think if anyone leaves you
Mhm.
for whatever reason, that goodbye should not be a burning of bridge.
Mhm.
It's different if there's embezzlement of funds. If it's different if there's intentional neglect towards a patient. Those kind of things are very different. And yes, those are disciplinary causes. But if it's anything like, oh, doc, I moved here and the commute is too long, you can't just think about yourself. You have to understand that they have a life. They have as much right to leading that life the way they want as you do. And you have to be gracious. And my mentor said this to me, Dr. Duncanson Jr., who I did my master's under, that no matter what happens, you have to be bigger than the situation.
Excellent.
And
That's a great point. I really like that. Sorry, you were saying something.
I was saying, and then you have those moments when suddenly too many people leave, and that time you get down on your knees and pray it works out. It works out. You learn something. It will not be forever. It'll pass. So
Right.
take heart, and if you're in practice long enough, the first 2 years of practice, if an assistant left, I would have, I would fall apart internally. And guess what? You're still going to go. You're still going to see your patients. It's okay. Somebody else will come along. Nothing will stop. So, yeah.
I agree. So, Parul, those were excellent points.